Let me begin by asking you a simple but powerful question. What would our world look like if every child had access to quality health care, no matter where they lived or what their family earned? Today, we're spending the next hour exploring practical, realistic, and effective strategies for finding funding to support underserved children's health. Whether you're part of an NGO, a community group, or a school initiative, this guide will help you navigate the landscape of opportunities designed to make life-changing impact. Many children continue to face challenges that directly affect their well-being. Poor nutrition, lack of clean water, limited access to clinics, untreated chronic conditions, and mental health struggles all contribute to inequalities. In underserved communities, these problems often overlap, making targeted support and well-structured projects essential. Funders today are increasingly interested in solutions that consider the full picture, not just medical care, but the environment around the child. Poverty, unsafe housing, limited education, and exposure to stress all shape health outcomes. When NGOs acknowledge these factors in their planning and proposals, the solutions become stronger and more appealing to donors. A clear needs assessment helps you understand exactly where gaps exist, identify which children need urgent support, prioritize interventions, strengthen your proposal, build credibility with funders, gather data through surveys, interviews, school records, clinic reports, and community discussions. Once the evidence is collected, patterns begin to emerge. Some communities may lack preventive care. Others may struggle with malnutrition or unaddressed mental health concerns. This is where your project's focus becomes sharper. Funders appreciate specificity. They want to see that you understand not just the community's challenges, but also the root causes behind them. Here are the major sources of funding you'll be exploring. Foundation and philanthropic grants. Corporate social responsibility, CSR, programs. Government and public sector funding. Crowdfunding and community donations. Innovation and digital health grants. Each of these will be covered in more detail in the following segments. Private foundations, both large and small, regularly support child-focused health programs. They often look for well-defined projects with measurable impact. Whether your organization is proposing health camps, nutrition drives, telehealth visits, or community health worker training, foundations appreciate structured interventions backed by strong data and community need. Corporations support children's healthcare projects because it strengthens their brand reputation. It aligns with their social responsibility goals. It gives employees purpose and community impact opportunities. It demonstrates long-term societal commitment. NGOs should prepare professional proposals, highlight community reach, and show how the partnership benefits both sides. Government agencies often run programs related to maternal and child health, essential medicines, immunization, nutrition, and community outreach. Many NGOs overlook these opportunities, but aligning with national and district-level priorities can open long-term funding doors. Building relationships with local officials often leads to additional collaboration. Strong crowdfunding campaigns include a clear, emotional story, visuals showing real needs, a specific financial goal, regular updates and transparent reporting. A powerful call to action. This method is perfect for medical emergencies, nutrition drives, mobile clinics, and short-term interventions. Technology-focused funders are increasingly supporting solutions that use digital tools to reach vulnerable children. This includes telemedicine, mobile health education, digital record keeping, and remote monitoring. If your organization uses or wants to use technology effectively, innovation grants can unlock transformative opportunities. Funders expect to see a clear problem statement, Measurable objectives. Step-by-step activities. A realistic timeline. Roles and responsibilities. A well-structured budget. Monitoring plans. Clarity and structure often matter more than complex language. Numbers help establish scale, but stories help establish humanity. In your proposal, include simple statistics from your needs assessment, but balance them with real stories, such as a child struggling with asthma or a student missing school due to untreated infections. This blend creates emotional connection while keeping the proposal grounded in evidence. Partnerships can include local clinics or hospitals, school administrations, community leaders, universities and health colleges, and other NGOs. Partnerships increase credibility and show funders that your solution is community-driven, not isolated. Funders want to know that your project won't disappear when the grant ends. Sustainability can be demonstrated by training community volunteers, building local leadership, forming long-term partnerships, diversifying funding sources, or integrating programs into existing community structures. Showing these elements significantly increases your chances of receiving funding. Your M&E plan might include pre- and post-program surveys, health screening results, attendance logs, awareness measures, impact stories, and data dashboards and reports. Funders want to see that you're committed to learning and improving. Meaningful engagement with parents, caregivers, youth groups, local businesses, and community leaders improves both participation and sustainability. People support programs they feel involved in. Community involvement also helps spread awareness quickly and builds trust between the NGO and the families being served. Advocacy includes raising awareness about local health challenges, promoting policy changes, hosting community meetings, campaigning for better services, and working with media. Advocacy positions your organization as a leader and can attract more funding. In today's world, visibility is impact. NGOs should use social media, newsletters, websites, and WhatsApp groups to share their progress, success stories, and health tips. Donors want to see transparency, updates, and real-world change. Strong communication increases donor trust and long-term engagement. Good budgets include clear cost categories, justification for each cost, realistic pricing, administrative costs, monitoring and communication expenses, and a contingency buffer. Simple, transparent budgets help funders trust you. Many major funders love to see pilot projects. Even with limited resources, you can test an idea, collect results, learn what works, and then use this information to apply for larger, multi-year grants. Think of pilots as stepping stones toward greater impact. A practical checklist: conduct a needs assessment, identify the gaps, choose a realistic intervention, map funding opportunities, build partnerships, prepare a strong proposal, ensure sustainability, develop a monitoring plan, communicate regularly, and strengthen your visibility. Many NGOs struggle to secure funding because they unintentionally make errors such as submitting generic proposals without community-specific data, overpromising results that cannot be measured, ignoring donor guidelines or eligibility criteria, providing unclear budgets with missing justifications, and failing to show sustainability or long-term planning. Correcting these mistakes instantly increases your chances of success. Funders look for organizations that are equipped to manage projects efficiently. Investing in your team's skills, such as financial management, data collection, digital literacy, safeguarding, and reporting, can significantly strengthen your credibility. Capacity building shows donors that your NGO is professional, reliable, and ready to scale its work. You don't need complex systems to show impact. Simple tools like Google Forms for surveys, Excel or free dashboards for data tracking, WhatsApp groups for beneficiary feedback, photo and video documentation, and short monthly progress reports help you demonstrate transparency, consistency, and real change, qualities every donor values. Remember, you don't need a huge team or a massive budget to make an impact. Every small effort counts. Every child you help creates a ripple that reaches far beyond your organization. Fundraising is challenging, but with the right tools and the right approach, you can secure the resources your community needs. Thank you for joining this session. I hope these strategies empower you to design stronger programs, write better proposals, and reach more children who need support. If you're looking for more resources, grant listings, or step-by-step guidance, visit Funds for NGOs. Together, we can break barriers and make healthcare accessible for every child. Thank you, and see you next time.